All right, so there's 3 ways to handle pain in the shoulder, rotator cuff, what have you, okay? You can ignore it, okay, like, oh, it'll just go away. I mean, we've all said that about a pain in our lives, and you know, we keep saying that because it probably worked a lot of the time, okay? You can alter it, okay? So altering sometimes is good and sometimes is bad, okay? Let's say you get a cortisone injection. I've heard this a lot. Oh, last time my shoulder hurt, I got an injection and it lasted 3 years. Well, the medicine was out of you. The half-life of most steroids is about 2 weeks. Now, there are some longer lasting ones, but let's just go with 2 weeks. That's half-life. Guess what the full life is? A month. Okay, so the drug is out of you after a month. So yeah, maybe it settled things down long enough for you to not need to do any exercise. You get back in life, you're doing everything you want for 3 years, great, okay? You can also alter it by taking pills, you know, pain medication, anti-inflammatories and stuff. And again, sometimes that works because your problem isn't super mechanical. It's like, oh yeah, it just needs, you know, a few weeks for the things to heal. So the inflammatory process is a healing process, okay? What happens is you send a bunch of blood flow to that area and a bunch of things that eat up whatever's torn, and then you lay down scar tissue, okay? Sometimes the scar tissue lays down just like you want it. Other times it lays down like a hairball, okay? Then it needs to be remodeled because now you got this thing that's all uncomfortable, and when you go too far that way, you're like, oh, it's pulling on that, okay? Then sometimes you gotta kind of stretch that out, either with a therapist or with some simple exercises and stuff. The last thing to do is to handle it, okay? There's 4 simple exercises that may help your pain. Now, the first one I'm gonna show you guys, there's 2 versions of it, okay? Because if your pain is impingement, I don't want you doing it with your hands up like this because a lot of times this position hurts, okay? But this position works best if your problem is lack of motion up here. This position works better if it's a little bit lower, okay? So, number 1, you never want to lace your fingers. And I'm going to turn sideways here and show you why. Now I'm cranking my head forward. Not a good look. This is the posture that we were talking about earlier that the computer people are in, okay, that the teachers and dentists are in. So a lot of times that really irritates them. So that's why I have them just have their fingers meet. You see, I mean, that's a good 6 inches extra of distance I have, so where I don't have to yank my head down. All right, so looking from the side here, fingers not laced, just touching in front. I turn as far as I can go comfortably to the right. I turn as far as I can go comfortably to the left, okay? I do that 15, 20, 30 times till I feel loose. That's a great exercise for, I stereotyped oil and gas workers because that's who we see a lot of around here because, hey, it's the Houston area, okay? But anybody who works long hours at a computer, that's a great thing to do. Try and do every hour, okay? If you got the pain coming down this way, same thing, right, left, repeat, okay? A lot of time, does anyone want to try that right now? Try it. Do you have any pains in your shoulders or anything right now? Okay, so do it like this, okay? So turn right, okay, and left, okay. So you look good. Here's what a lot of people I see do. Because they're limited, they do this and this because they're trying to go as far as they can. So I'm like, no, I don't care if you only go 25% because that's all you got. But I want the movement to happen here and not all down here. Because a lot of times if you got a problem here, you might also have one in your low back or your pelvis or whatever, okay? So we want to make the movement happen where the problem is, because we're probably already moving too much somewhere else to compensate for that lack of mobility here, okay? So again, to review, first one, here, if you don't have the shoulder pain, maybe if it's your neck pain or whatever, and by shoulder pain I mean that impingement stuff, okay? If you do have the impingement stuff, try and do it here. And again, you see how I'm making this X with my arms? I'm not leading with my head, okay? I don't want the neck to move because it may be trying to move too much, and that may be why I got neck pain, Okay, so nice and easy and controlled, right, left, okay, and then depending on how the person responds to those movements, let's say they come back on visit 2 and they're like, they say, yes, I got 5 minutes of relief after I do my exercises or something, or I only hurt when I'm on the computer for more than 10 hours a day, so on hour 9 I start doing this at the office. And every hour I do some, and I tell them, look, don't even count. Just do till you feel like it loosens you up, okay? You're already working enough with your mind. You don't want to count a bunch of stupid exercise repetitions off, okay? So just do that. Try and do it regularly. Also with those people, how many of you have had therapy before? 1, 2, have you, sir? Ma'am? Okay, so, a lot of times we'll be like, oh, here's 4 exercises and do them twice a day, and you'll do them once in the morning, once in the afternoon or something. With those, don't do them all together. Do this one at 8 a.m. Do this one at 9 a.m. Do exercise number 3 at 10 a.m. I want them to split it up because I want them to break it up kind of like that office athlete thing does. Now that's more frequently, but I'm trying to work with them because, again, like I said, these people are like, I got a project, I got to get it done, got to go, we got deadlines and stuff like that. The carpool buses downtown, the last one leaves at like 6 o'clock and I got to get all this done before that. So, there's so many things that we have to try and work around in our lives to get this stuff better and to kind of focus on ourselves because it's really ruining our quality of life, at least if you're taking the what's that carpool bus called? Park and ride, yeah, the park and ride. So at least if you're taking the park and ride, you're not driving, okay? Driving's another thing that, and a lot of the new seats to cut down on whiplashes, guess what? The headrest is bent forward. I had one lady, she and her husband had bought a new Ford truck. This was probably 6 or 7 years ago. And I'm like, well, let's see. Luckily, the headrest was removable. I picked it up, flipped it around, stuck it back in. She's like, oh my God, that's so much better. I'm like, this is the first time I ever tried it. I can't believe it worked. I'm like, but I saw her, I didn't see her too often. I saw her like once every week, once every 2 weeks. So let's say I saw her a week later. She came back. I'm like, are you having any problems with the headrest turnaround? She's like, oh no, it's so much better. Okay. Another thing going to cars, I don't know why, but like the Chevy Tahoes and Suburbans seem to have some of the best seats. Like most people with neck pain hurt when they drive. The Tahoe drivers don't hurt when they drive, okay? Now this goes back more often, and I think, this goes back to when I saw a lot more people having pain in their cars. I think seat design has come a long way in the last decade. I don't see that nearly as much, or maybe again, park and rides increase so people just aren't driving as much. I'm not sure, but seat design seems to have really, really improved over the last decade. All right, so another exercise you can do. Can you grab me a TheraBand real quick? I'll skip to another one while she's getting that. So we talked about the thoracic spine, very important, okay? So thoracic extension is basically bending back, okay? So again, if you don't have the impingement problem, thank you. Put the fingers up here, elbows together, butt against the back of the seat. Try not to arch your lower back. Eyes on the elbows, because if you don't keep them on the elbows, you do this. Now, yeah, I'm moving here, but I'm also cranking my head back, okay? So eyes on elbows, and if you're tall enough, you can really use this as a leverage point to bend over, okay? Now you see I'm not going back a ton, but here's what I don't want. Now you can probably see the best, you two ladies, how I'm arching my low back, okay? We don't want that, okay? Another good exercise, if you have the impingement thing, if you recall, guys and gals, what I said was if you have the impingement problem, you want to strengthen the rotator cuff. One really good exercise is external rotation. Now this is a very, very light resistance band that I'm demonstrating with, and you don't want to crank it way out. I see a lot of people I teach them it in the clinic, they do it, they're like, oh, it didn't hurt. Then they come back, they're like, oh, those exercises killed me. I'm like, all right, well, it could have been a fluke that it helped you that day, but let's see how you're doing it. And I know what I'm looking for. I'm looking for this crazy, like as wide as they can do it. And that's almost always what they do. And I'm like, no, you know, start about 6 inches apart, go maybe a hair wider than shoulder width, but not cranking way out, okay? So why don't you try that, sir? And I like them to keep their hands more like thumbs up position. Yeah. You don't have to have the thumbs up, just, yeah. And then some people, when they have weakness, this is what they look like. Tell me what I'm doing wrong here. All right, sir, I'm gonna ask you. Tell me what I'm doing wrong here.
Only one side.
Only one side, and the other side's doing the wrist. I'm like, no, you gotta keep that wrist rock solid and do it like this, not, okay? If they're doing that, I'll take that from you, then they need to get a lower resistance band to where they can actually do it right. Or,
I would have got stronger.
what's that?
I would have got stronger.
Yeah. Or you can do it with just one arm, and I'll show you with my left here, so you're sure you're getting that, okay? Because doing it with just one arm, you're not getting the increase in resistance by the other arm doing it, so now I'm just doing one armed external rotation, okay? The last thing that I haven't mentioned yet, and all right, so when we have patients fill out their paperwork and stuff, time out, I was like, can you grab me a water? I'm sorry. My son golfed all day today, and I drank a half gallon of water, so if I'm all red in the face, it's because I'm sunburnt, but I'm still a little bit dehydrated. So on our patient paperwork, okay, we have this body diagram, front of the body, back of the body. It's like a faceless person, and I just say, color in wherever you're hurting. Thank you so much. I love when people color in right here, okay? Because that says, wow, I'm gonna only have to see her 2 visits, okay? And does anybody have pain right here or a crick in their neck? That's the other thing. I love when they say, oh, I woke up with a crick in my neck.
It hurts there in other places.
Okay, so do you mind coming up here? Okay. I'm gonna sit you in the front here. So a lot of times that's a first rib problem, and I can fix it pretty easily. Okay, so if it hurts, stop. Look up as far as you can until it hurts. Does it hurt in that spot? Okay, can you look up any further? Okay, does it hurt in that spot at all? Sorry.
That's okay.
Let's go. Okay, hang your head down. Does it hurt in that spot at all?
Yeah, it hurts more in my neck, but nothing right in here.
Oh, okay, I'm sorry. When does that hurt? When you wake up in the morning?
When I do this.
Okay.
Or if I'm asleep at night, I notice that my arm falls out.
Mm-hmm. And then you start to feel pain here?
And I feel pain there, and it radiates down my elbows.
Does it hurt just to the elbow or lower?
Lower.
Okay. All right, so let's see. All right, so I'm looking at her first rib. Remember, guys, I told you the first rib kind of runs from there and dives down forward to where my thumbs are and attaches to your sternum, the breastbone right in through here, okay?
Yes, Sean, it burns. It burns.
Burning, good sign, maybe an easy fix. Okay, so if both sides hurt, it's probably not the first rib, it's probably the spine. Okay, so I'm gonna push on your left side. Now, if she's positive, this is gonna hurt like heck on the right. Okay, so how awful is that? Is she making any faces?
A little.
Okay.
Oh, yeah.
Okay, all right, so we saw both sides sore, okay? I'm sorry.
That's okay.
We saw both sides sore. She's not somebody I'm gonna look at first rib for. I'm gonna look at a couple of those exercises I showed you in the chair. Now, do you have any of the impingement stuff, like when you're raised? Okay, so.
And I had surgery 3 years ago.
Okay, so hang your head down one more time, and it hurts right there?
It's just.
A little limited? Okay. All right. So scoot your rear end forward a little in the seat. Okay. Cross your arms to your chest. okay? Turn left and right about 20 to each side. So what I'm looking for is that she's not doing that shifting, and she's not. She's just doing the pure rotation.
Kind of snapped.
Put your right arm on top. See if, and relax your hands. Yeah.
Popped. Just popped.
Does that feel any better with the right arm on top?
Yeah.
Okay. So again, we're just changing technique, like, okay, the position's uncomfortable. If we change it, let's see if it feels a little bit better. Getting irritated?
No.
Okay. She's not going to look better looking down. Look, hang your head down. Any more mobility there?
Yeah, it's not, it's looser.
Really, I'm surprised. Probably because you got 2 or 3 other things going on. You're having the popping in the shoulder and stuff. So my thought is that you probably got some lack of thoracic mobility. Can you do the fingers behind your neck and scoot against the back of the seat? Elbows in front of your face. How bad does that hurt your shoulder? Yeah, okay, all right. Gonna stop. So there's some other stuff we would do. If you want, you can have a seat back in the chair. So some more exercises like shoulder. If you've ever been to therapy, you saw the people, they have shoulder surgery, they're doing the pulleys, okay? That's gonna be a lot easier. So you use one arm to pull the other arm up and then vice versa. And that's going, as you get higher, I'm really exaggerating for demonstration purposes, but you can see that I'm going to be extending here a little bit like I was trying to do with her shoulder stuff, okay? Something else, if all that hurts, like I can see on her face right now, she's not feeling too good, I can do some manual stuff. So I can have her just kind of lie down on the mat. You've seen those mats with the little face hole in them. Get her comfortable and just kind of gently push on her upper back and get a lot of that stuff out to a lot of the pain out, increase some mobility, and then she would probably do this afterward and be like, oh, it's not popping as much, and oh, hey, I'm hanging down, and oh, yeah. But I'm going to help you with that in about 2 minutes, okay? So nobody has like a crick in their neck kind of thing? Ever wakes up with it? Okay. It only really works if I have a person to demonstrate on. But you saw me kind of mashing down on her shoulder, okay? So those first rib people, they color in right here, and it's only right there. It's like this little tiny area they color in. It hurts when they look up, it hurts when they look down, sometimes turn, sometimes side bend, but you push on that, the right side will like light them up, the left side's like, no, I don't really feel anything. So I push down on it, okay? Then I teach them how to do it to themselves. So a gait belt. Gait is what we call like walking, okay? So we put gait belts around people's waists when they're in the hospital, so we hold on to them, so as we're helping them walk and get their 100 steps that they have to achieve before they get discharged, okay? We hold that in case they trip or fall. We're catching them and maybe controlling a fall or whatever. At least they're not just going, okay? So we definitely use those for that, but we also use them because they're very strong. They're canvas belts about, I'd say 2 inches wide, okay? And the ones I buy are 54 inches long, and you put it over you like a beauty sash. I'll show you with this. Okay, so it would be over the back, over the front, okay? And then you back your elbow up into it, and you push down as it's wrapped around here, and that's a great self-rib mobilization, okay? We buy them for 10 bucks, we sell them for 10 bucks. I send people home for like a week, have them come back, they tell me, I feel better, or no, I don't. If they don't feel better and it worked great in the clinic, it's because they're like, oh, I thought it was out here. And the goofy thing I always tell them, and it sounds really bad, but it puts a picture in their minds that they know how if they have it on right. It's got to be halfway choking you. Now it's not really choking you, but it comes kind of right across the neck there, and you know, most of us aren't comfortable putting things and a lot of pressure that close to where we're breathing, okay? But I tell them, hey, it's got to be halfway choking you. They push down, breathe in, breathe out, push harder, do it a lot, and a lot of times first thing in the morning, and it helps a ton, okay? These people are the ones that wake up with the crick in their neck, okay? They're the ones that are side sleepers that wake up with the pain. My favorite guy, I saw him twice. computer worker, like this all day, IT guy, okay? All he does is computers, okay? He always felt worse in the morning. All he had to do every morning is do it, I don't know, 30 seconds a minute. He didn't hurt all day. Like, wow, that's awesome. Now, he is definitely the outlier, but I saw him twice, okay? Gave him that, gave him a few stretches because he had been stiff, okay? And some of your muscles, you guys know what guy wires are? Like if you picture the radio transmission towers, they got all those wires. You got a bunch of little muscles that support your neck that attach to your rib and your shoulder blade and your collarbone. They're called scalenes. So you got all these guy wires coming off here. And if that rib's been popped up for a while, guess what? That muscle's shortened somewhat, okay? So I'll have him do the mobilization, then very gentle stretches, because if the muscle's shortened and then you crank into a stretch, guess what you're gonna do? You're gonna pop the first rib up again, okay? So we teach him some gentle stretches and stuff, like, 2 or 3. I mean, the guy had no other issues. I mean, easy patient. Lucky him, 2 visits done, Maybe he didn't even have a copay. And then he's not out any money. Guys, because that's the thing, physical therapy isn't cheap, especially if you're coming lots and lots of times. And now most of us have plans, healthcare plans that have $500, $2,000, $5,000 deductibles, and you're like, well, is this really going to work? And my doctor says I got to go 12 times. That's a lot of money, okay? But if you go somewhere, you get the right person who's either going to say, yeah, come in once a week, or yeah, you do need to come in this often because everything I teach you, you're constantly doing it wrong, and I got to be right there with you, and I'm not going to give you home exercises until I'm confident you're going to do them right, because the first 2 times I sent you home with stuff, you went home, did the stuff that fixed you in the clinic, and felt worse when you did it at home, okay? So there's a lot of things that go into that. If you're an exercise person, you're going to need way less frequent therapy. If you have a long history of exercising and you're not in that age demographic where you still do what we tell you not to do, you can cut your visits down a lot and make it a lot cheaper. Okay, so here's what successful treatment looks like. I already spoke about her. She's gonna need some manual hands-on stuff because you saw all the exercises I had her do made her worse, okay? If some of you guys have had therapy before, hopefully not at this place, but possibly somewhere else, if they gave you exercises to do and didn't evaluate how you felt before compared to after them, that's not physical therapy. That's just running through the motions and saying, hey, I got my physical therapy license, go do this, I'm the expert, don't tell me it hurts, okay? And then I'll wonder, oh, why isn't she getting better? Why'd she stop coming after 4 visits, okay? Next thing is, exercises. I've spoken about a lot of exercises, but again, as much as they can be pain-free, okay? If it does hurt, like I told you guys about that first rib mobilization, you saw her say, yeah, that's really bad, okay? That's gonna hurt. But if as a result she's like, oh man, I can look all the way up and it doesn't hurt, that's acceptable, okay? So you gotta know when it's acceptable to hurt and when it's not. And again, I think you saw, I stopped as soon as I could because I'm like, all right, number 1, both sides hurt, probably not just a first rib problem. Number 2, we did this exercise, your face isn't looking good, stop, okay? Number 3 then is the education, and that's the thing I hope you guys understand. I've been trying to push a lot. I want to teach you why you're doing it so you understand what to do, and I want to teach you the tricks. You don't have to go through your 9 home exercises when it just hurts when you do this. Maybe you just get that band, hold it with 2 hands and do this 10, 15 times, then you go back to work or hammering on the siding or whatever you're doing, pain-free, okay? That's our job, to teach you how to kind of manage things and then long-term how to fix things, okay? Here's what you do next, okay? If you want some treatment, you can schedule with them up front. If you have a bunch of questions, I have no problem meeting with you individually. I am going to help her briefly before that because I did give her a little bit of pain. If you want any help maybe in the future, you can go online at fortbendpt.com or sugarlandpt.com. You can give us a call, 281-239-3838. That's here in our Rosenberg clinic. And then, all right, let's go over here. I will be back in like 2 to 3 minutes.